Good morning, friends. I want to talk about bone loss today. If you have metastatic prostate cancer that's, past, well, I don't know what they call it, no longer localized. It's actually spread. I've had a lot of bone pain 24/7 for the last almost 30 months. But praise God that my wife and my friends have prayed for me, and my T11 had burst. Is the pain's gone in my center of my back. But now I've been having pain in my pelvis and on my hip, down my leg. Quite severe pain. That's how it started out, is quite severe. And I couldn't sit in the car and push on the gas pedal. I couldn't sit on the toilet without actually yelling. It was painful. So I went to the doctor. I went to my family doctor. And she said, well, let's send you for x-rays. Actually, it was the same day. I ended up going for x-rays. And this is what they found. They did an x-ray of my pelvis, hip, or whatever. And it says moderate to severe disc degeneration and faucet arthrosis at the L5-S1. Mild to moderate osteoarthritis in the right hip and mild osteoarthritis in the left hip. Calcified enthrostope at the left femoral greater truss or hatter again. Well, I'm sorry, I don't know these big words. I'll try to do my best. So I wanted to know what to do. I believed that it was being caused from the ADT hormone treatment. So I made an appointment with my doctors, not the oncologist, just my palliative doctor and nurse. And I said, I'm really discouraged about these drugs hurting my bones. If I'm doing so well, can I stop the cancer drugs to save my bones for a little bit? Remember to ask for a bone builder, because they never offered it to me. For the first year and a half, I didn't even know there was such a thing. And somebody else, another YouTube channel I watched, a friend, and he talked about them. So I went to the doctor to ask him about a bone builder. What did he do? He gets onto Google to look it up. He said, oh, okay, yeah, you should be on this bone builder. So I take a pill once a week. But I believe, this is in my heart, I believe I'm losing more bone than it's making. And why do I believe this? Even though when I went to see my doctor, and I questioned him about this, he said, no, your drugs won't do that. You're getting old. These are things that are happening because you're getting old. I was quite discouraged because I'm we're not stupid these days. We have internet. We look this stuff up. Or if you don't, you should. First of all, I'm on abiraterone, which is a Zytiga. I take 1,000 milligrams a day. Common side effects. Common side effects is fatigue and joint pain, high blood pressure, low potassium levels in the blood, fluid retention and swelling, hot flashes, headaches, diarrhea, high blood pressure, sugars levels, etc., hyperglycemia. Serious side effects. I mean, the list is pages long. I mean, even when you get Tylenol or whatever, or any stuff we're on, there's pages of side effects. Do we read them? We should. Don't. Do the doctors tell you all this stuff? No. Serious side effects. Liver damage. My thyroid's been damaged. I'm on pills now for my thyroid. Indicated, adrenal corticosteroid, I don't know, the insufficient. It says low stress hormone levels. Heart problems, including irregular heartbeat. Increased risk of bone fractures, and bone thinning. Osteoporosis. Doctor said no. And then on Zoladex, which is I get it injected once every 3 months not fun. Common side effects. Hot flashes, sweating, mood changes, changes in sex drive, headaches, bruising, pain, bone thinning, osteoporosis with long-term use. So that's 2 out of 2 so far. I mean, it doesn't even go through all the different things that, the side effects. They don't talk about you losing all your, you're cloudy, you can't make thoughts right, you have a cloudy brain, you lose all your body hair. I mean, there's all kinds of stuff that they don't tell you about, Prednisone, which is a lot of people are on prednisone. Sorry. Short-term of prednisone may cause anxiety, insomnia, while long-term is associated with more serious issues. Increased risk of infection, increased blood sugar levels, high blood pressure, osteoporosis and bone loss, cataracts, adrenal gland suppression. Can't do that. How do you do that? 3 out of 3 of the drugs I'm on. I mean, I'm just talking about the ADT hormone drugs. It is listed as a serious side effects. We have to know. They should have told us that right from day one. Make sure you're on a bone builder. Make sure you're taking calcium. Not too much, because it goes to the wrong places. You have to take a lot of D3. K2D3, I don't know how many you want to take a day, but you want to take a lot.
Cissus.
Cissus is a bone builder. I even took what they call Prostate Max, and I forget that exact name of it. Anything I can take that was going to help. And then, like I say, I read what they had done to me, and I had no idea what that meant. Fasciate arthrosis, a degenerative arthritis-like condition where cartilage in spine's fasciate joint breaks down, causing pain, stiffness, and bone spurs, particularly in the neck and the lower back. And that's where I'm having issues. My neck, I can have a hard time turning my neck, and right at the bottom of my pelvis, my spine. But the pain in my T11's been gone since they prayed for me. It's never, I mean, I had it for almost 30 months, and it's gone. I mean, God's watching over us, not all science, but I believe in prayer so much. Then, degenerative disc disease. They say it's an age-related condition where spinal discs lose moisture and structure, leading to pain, stiffness, and potential nerve compression in the neck or lower back. Treatment includes therapy, medication, and life changes. No cure. It says right here, because of limited blood supply, they will not heal on their own. Osteoarthritis is a common progressive joint disease where the cartilage breaks down, causing pain, stiffness, reduced mobility as the bones rub together, affecting hips, knees, spine, and other joints. Managed by life changes, medication. It's not reversible. Yeah, this is right there. Doctor's exam, symptoms review of x-rays showing cartilage and bone loss. Management, and there's no cure. Physical therapy and medication and injections. Calcified anthracite. Have patients with these barge worked with me. I had no idea what this was. It says a bony calcium-based spur forming where tendons and ligaments attach to the bone, typically resulting from chronic distress, inflammation, or aging. It's a degenerative thing. Inflammation, arthritis is also such as, looks like ankylosing spondylitis or psoriatic arthritis. I'm not sure of these words. Symptoms, pain. We knew that. Diagnosis is x-rays, ultrasounds. Treatment. Focuses on alleviating symptoms rather than even removing the spur itself.
But D3 takes calcium from where it's not supposed to be. So.
Yeah. My wife just reminded me, the D3, why we take the D3? It takes that calcium and put it where it's supposed to go. Or you'll end up with these calcium lumps where they're not supposed to be.
Or it goes into your veins and gives you a heart attack.
Yes, and that's one thing we have to worry about. With metastatic, it goes to your bones. And with the calcium, that doesn't go to the right places. It ends up in your blood. That's why we have these warnings about heart disease, or heart problems, because of the calcium in our blood. And it says I have left, because it talks about, treatment, pain, medication, which like cortisone injections. I'm up for a cortisone injection a week from today. I've never had it. I know I have to go to the hospital and they're going to do some kind of a scan and then do it during the scan or something. I will do a report on how it went and what it was like after I have it done next week. And it says left greater femoral trioshatter. I didn't know what that was. It says it's the greater trachea is a large, irregular, bony prominence located at the top or outer side of the femur, the thigh bone. It is a femur. Okay, thank you. It is a critical anatomical landmark where several important muscles, notably the gluteus medius and the gluteus maximus tendons insert. That's supposedly where I have this calcium buildup or bone, or I don't know what they call it. I'll hopefully know more next week. But I'm just so discouraged that we need to know that you're going to have bone loss. We take these medications, they say, to give us more time, to slow down the cancer, to give us more time. But these pills are attacking your bones. You got to be careful out there. You got to read the side effects. You got to know what they do to your system. Because this is an odd battle we're dealing with. If you're not a Christian and you don't pray to God, I don't know how you're going to get through this. He's given me the strength to keep going through this day by day. He's there with me, that I can go out and continue to try to have a life while dealing with this. It's a different life than what I had before, that's for sure. And I'm lucky that I have the support of my wonderful wife who's been through this with me the whole way. She goes to all my appointments. She goes with me for all my scans at the hospital. She prays for me every day. So I'm just warning you guys, knowledge is important. Look up the medications you're on. Look at the side effects that they have. What can you do about it? Because if the cancer doesn't kill you, are the pills going to do it? Are we just going to get to a point where we end up in a wheelchair? We don't want that, do we? Take care, you guys, and God bless you.